Cardiologists and echocardiography technicians are the ones who perform an echocardiography on the patient. An echocardiography is an invaluable tool that will help us understand how your heart is functioning, and it is an instrument that sends ultrasonic waves to your heart to understand how the chambers of the heart contracting and to see the amount of blood that is being pushed out of the heart. Now, the heart is composed of broadly two components, that is the atria and the ventricles. These are the chambers of the heart, two atria and two ventricles. Now you have blood vessels that reach the heart and the blood vessels that are moving outside the heart. The blood vessels that reach the heart are the veins, and the blood vessels that leave the heart are the arteries. Now, the echocardiography will help us understand whether the chambers of the heart are beating properly, whether any part or any chamber or the walls of the heart have died due to loss of blood supply to the heart. It will also tell us if the blood is being pumped efficiently from the veins to the heart, that is the atria, and then the ventricles, and then the two systems. The two systems are the systemic circulation and the pulmonary circulation. So this is basically the amount of blood that goes from the heart to the rest of the body and from the heart to the lungs. An echocardiography will help us understand whether there's any obstruction to the flow of blood. It will also tell us how the valves of the heart are functioning. Now, the blood that is flowing through the heart moves in one direction. An echocardiography will tell us whether there is any movement of the blood in the opposite direction. It can tell us whether there is something growing inside the heart, or whether there's a clot, or whether the entire heart is encased in two layers. And this layer may sometimes fill up with blood or fluid, which is known as pericardial effusion. So doing an echocardiography will help us understand whether pericardial effusion exists or not. However, an echocardiography will help us understand how your heart is functioning when it is at rest. There are other tests that tell us whether your heart functions well under pressure. One is the treadmill test, and the other one is a dobutamine stress echo. So a treadmill test is basically assessing whether you can perform a strenuous physical activity with no insult to your heart. They will check whether your heart is beating fine, even though you are running or lifting a heavy weight or basically doing any sort of physical activity. Now, there are some patients who cannot run or who cannot walk or have back issues, or they're immobilized and they have a fracture in their leg, or they're not able to walk. For such people, cardiologists use something known as a dobutamine stress echo. So this is basically a drug that is injected into your veins, and this will cause a little bit of pressure to act on the heart. And this is a method to identify whether your heart can still function under pressure even when you are sitting down or lying down. Now, this is especially important to us because it simulates the scenario of how the heart can function when it is put under pressure, such as anesthesia or surgery. Now, this is extremely vital to us because once we know how your heart functions, then we can predict how your heart might function under anesthesia or under surgery. And it helps us predict what may happen during anesthesia or surgery and even after anesthesia or surgery. And this is especially important because it will help us tell you what your status of your heart is and what the condition of your physical fitness is. And this will help us plan your stay in the hospital. It'll help us plan for any complications that can occur. And it can also prepare you for what is to come and how to manage your life from that minute onwards.